I'm Dr. Andy Weber. I'm here today with Carissa.
Hello.
We're with Excellent Dental Specialist, and it's Dental Hygiene Month this month in October. So we wanted to talk briefly about some of the things that we go through, and specifically, with hygienists and what they actually go through to become a hygienist. So Carissa, can you talk a little bit about how the process was to go into dental hygiene school? What do you have to do just to get in?
Absolutely. So just to get in, it was I had to take my prerequisites through any accredited college, and then I had to take an entrance exam. I had to pass a couple of tests just to be able to qualify to get into hygiene school. And then once I was admitted to hygiene school.
In college, you're talking about chemistry, biology,
microbiology, your physics courses, basic English, algebra, math, anatomies, all of it. It was involved.
Yeah, same things that we got to do, that I had to do as well.
Mm-hmm. And then once I got into hygiene school, you had to take pharmacology, and you had to take more advanced anatomy courses, and your embryology classes, and how the teeth work, and your perio classes. Those were always my favorites. And then on top of all of your clinical studies and oral pathology.
So yeah, there's a lot of extra training, and I think that's what's unique, is it's truly a profession. And so that being said, it's you're constantly learning, you're constantly going to courses. Is that correct?
Yes, absolutely. 8 to 5 a lot of days.
Yeah.
Plus your clinic hours where you're actually seeing patients and getting the hands-on knowledge as well.
And it's those are mandated things, and things that you also do above and beyond.
Yes.
Yeah. So I think a couple of the things that are kind of unique about being a hygienist especially is that your day is so packed. I look at your schedule and I'm like, oh my gosh, how can you do this? Can you talk a little bit about that?
So I have one patient every hour, and that always sometimes it includes x-rays and exams, sometimes it's I have to perio chart, which is where I measure the health of patients' gums, and then on top of scaling and everything else with that. So it's a lot to pack into 1 hour, but with proper time management and efficiency, and making sure that my instruments are sharp, and making sure that I have a really awesome doctor that buys me what I need, and everything else like that can help me do my job efficiently.
And surprisingly, a lot of times it's a lot of other offices, you're doing the cleanings that we do in half an hour. So
in half an hour.
We take the extra time because we are a periodontal office, and we have patients that have a lot of needs.
Mm-hmm.
And I think there's also the whole perspective, we all have teeth as well. We all have teeth issues, so we're normal mortals, so we have to go see the dentist as well.
Yes.
So I basically want to encourage, there's a little bit of a thought. I had a conversation with someone that said, well, I'm using the Oral-B, I'm using a water flosser. Why do I need to go and get my teeth cleaned?
Because your body, your saliva still has bacteria in it, and it's the mechanical removal of that calcified plaque and bacteria that needs to be mechanically removed, which only we can do here properly and safely and also effectively.
Yeah, save your teeth, come here to help us,
yes.
And we'll help you out. We are on your side. That's the other thing too. You'll form bonds with your patients.
Yes, absolutely. Patients we're like family here. So everybody we take into, their home status, any kind of financial account, like anything that would affect them, we kind of take it to heart, and we make sure that whatever happens, and we can do whatever we can to help, no matter what the situation is. We do our best for every patient, no matter where they're at in life.
Yeah, most definitely. So, really come and visit us. We're here to help you out. If there's any problems, we're going to catch it. We look at each patient also as an individual, like you said, both, that relationship. But if we're going to make a recommendation, it's basically individual.
Yes.
Correct?
Yes. There's not a one and done anything done here, because every patient is treated differently as an individual, because everybody is different.
Yeah.
So it's all on a case by case basis as to what treatment that they need, and everybody is treated with special care. Everybody is a VIP because everybody needs different treatment.
Definitely. Well, I think I'm reminded every time I look at my teeth now. We have these scanning devices, and I was appalled because I thought, oh my gosh, I got to get my teeth more cleaned, or cleaned more often. I've been going every 3 months since I was about 35. It's helped me a lot. It's bad business to have tooth loss from a dental standpoint. So, there's things that I'm a periodontist. I've got probably some of the best hand-eye dexterity when it comes to cleaning your own teeth, but even I miss things, and I have to go every 3 months or I will end up losing teeth. You know, quick statistic, the average 55-year-old in our country has already lost 12 teeth. The average, basically 1 in 3 over 65 have lost all of their teeth. So don't let that statistic become a reality. We can help you out. So visit Carissa. She's very much here to help you out. And
Thank you, Dr. Weber.